Well, good afternoon, everyone, and you'll see a new face at our table today. We are joined by Minister Warr, and we have Dr. Fitzgerald, who will be joining us by telephone. Of course, Minister Haggie is in his usual spot, and so we'll now go to Dr. Fitzgerald for her update.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today. I'll begin with an update on the number of cases in our province. Since the media briefing yesterday, we have 8 new positive cases. All of these cases are within Eastern Health Region. The public health contact tracing is ongoing, and everyone considered close contacts will be advised to quarantine. The total number of cases in our province is now 183. By region, we have 174 cases in Eastern, 3 in Central, 1 in Western, and 5 in Labrador-Grenville Health. Of the 183 cases, 143 are related to calls to funeral homes. 54% of cases are female and 46% male. By age, we have 14 people under the age of 20, 24 between 20 and 39, 31 between 40 and 49, 41 between 50 and 59, 38 between 60 and 69, and 35 who are 70 and above. 11 people are now in hospital due to the virus. Of these patients, 4 are in intensive care. 10 people have now recovered. In total, we have tested 2,929 people. Our public health officials are working tirelessly to protect you and contain the spread of our COVID-19 in our community. Our regional health authorities are there and ready to respond. I'd like to take this opportunity to thank everyone for following physical distancing measures. March in Newfoundland and Labrador always seems to drag on forever. I know these measures have magnified that feeling. I need everyone to understand that we are at the beginning of this epidemic in our province, and now is not the time to become complacent. These measures, if we stay vigilant, will work to reduce the spread of COVID-19 in our province as it has worked elsewhere. Thank you to healthcare workers for continuing to show up and care for people in this unprecedented and rapidly evolving time. Thank you to essential workers for continuing to provide the services that we all need to keep life as normal and connected as possible in this uncertain time. Your dedication to the people of Newfoundland and Labrador is inspiring. I'd also like to thank Sheila Keats and Heather Crane, our ASL interpreters, who have shown up every day to ensure that our messaging is accessible to all. And I personally would like to thank the public health team and the staff at the Department of Health and Community Services, as well as public health teams in the regional health authorities. I realize that I am the public health face that you see every day, except for the last few, but there is a whole team of people who are working tirelessly to ensure that we know the latest evidence and can apply the best science to shape our response to this virus. The regional public health teams are carrying out contact tracing and providing advice to all those who are identified as cases and contacts, and this is exceptionally important work in the control of COVID-19 spread. We must all do our part to reduce the spread of COVID-19. You must continue to protect yourself and your loved ones. Wash your hands frequently with soap and water or use a hand sanitizer with at least 60% alcohol. Avoid touching your face. Regularly clean high-touch surfaces such as doorknobs, remotes, and phones. Only go out when necessary and stay home if you are unwell. Our collective actions will have significant impact on how COVID-19 progresses in our province. Thank you.
Well, thank you once again, Dr. Fitzgerald. And I also want to reiterate some of the comments that was been made by Dr. Fitzgerald in her opening remarks there by thanking all our workers at Public Health. Indeed, they are doing a great job working, and many of them behind the scenes, keeping health and safety a priority for all Newfoundlanders and Labradorians. As Dr. Fitzgerald said, that for those of you that are following and abiding by the guidelines that she's put in place, once again, thank you very much. You know, collectively, our actions will get us through this. By working together and with physical distancing, we must work together to make sure we work our way through this period of time in our lives. We all know that the time is now. We must not let up. Being focused on priorities for social and economic well-being has been the priority for those of us that are working on your behalf. Every piece of work that we do is to protect and to support you. And just a reminder for those students, and we're going to be talking quite a bit about students today, but we just recently suspended the repayment of the provincial portion of your student loans. And for those of you who have listened to us and at this table talk about the supports for essential workers with childcare, well, I can tell you today that we've had some 65 childcare operators that have stepped up to support our essential workers. So I too want to recognize and thank them for their efforts. So in keeping with that theme today, I am joined by Minister Warr. Of course, for our students in the K-12 system and those essential workers, there's no question these are challenging times. These are challenging times for our students, for our educators, and for our families. So in challenging times, we always look for new ways to do things. So many actions that we've taken since mid-March would have been simply early in March. On March the 6th, we started to cancel school trips, school travel. In-class instruction was canceled or suspended on March the 16th, with the last day in class on March the 13th. So since then, the focus would be on ensuring learning continues for our students. So some information for our K-9 students, well, they will move on to the next grade level next year. And students that are eligible to graduate will receive a valid mark this year. So they will graduate on time, and they will not be disadvantaged in their plans for post-secondary studies. Learning resources are available for our K-9 students. So teachers will be in regular contact with our students throughout and to support their needs at this time. So teachers will be supported also by the district in developing new learning activities for you. So once again, I commend the efforts of our teachers who are supporting our students in their time of need. And you need look no further than what's happening on Facebook and Twitter and Instagram and throughout the social media platforms that we have available to us to see the tremendous work that our teachers are doing, staying engaged with their students, or indeed going above and beyond. So this is encouraging for students and all of us when we look at our own lives. And even today, I still get messages from teachers in my own life that encourage me and inspire me on a daily basis to keep going on and keep doing what we are doing on behalf of every Newfoundlander and Labradorian. I also know that this is the time of the year for high school students, well, you're feeling a little anxious because you're thinking about your post-secondary plans. But we can assure you that no student will be disadvantaged because of COVID-19. You'll have access to online learning opportunities. Your classroom will change. It could be your dining room, it could be your bedroom, it could be in some other room in your house. But your classroom will change from what you've been used to for most of your life. But you will have access to online learning activities. You will be given every opportunity to address any gaps in your learning, making sure that every measure is possible to support you. So at this point, I'd like to turn it over to Minister Warr to provide some further information on the K-12 system this year.
Thank you, Premier. The impacts of COVID-19 are bringing changes to our normal practices and routines on a daily basis. As our public health officials advise us, this is not a sprint, but a marathon. Given these circumstances and the knowledge that current restrictions due to the pandemic may continue for some time yet, public exams for this year are canceled. In addition, we have been in ongoing discussions with the English and Francophone school districts, and in consultation, we have determined that final exams for all high school and intermediate courses will also be canceled. As the Premier stated, our focus has been on ensuring learning continues for all students, particularly high school students and graduating students. The cancellation of exams does not mean that learning is ending or that the school year is over. In anticipation of the cancellation of exams, the school districts have been working to develop continuity of learning plans. These plans involve teacher support and the use of online learning platforms. For example, through the Center for Distance Learning and Innovation, otherwise known as CDLI, students can access high school courses and teachers can provide feedback, guidance, and support. The English School District also has its own mathematics YouTube channel with a variety of instructional videos and other resources for grades 7 to level 3. Teachers will also connect with students through platforms such as Google Classroom and Google Meet, a video conferencing tool. We appreciate that students will want to know what their current standing is at this point in time. They will receive a grade to reflect their work to March 13th, the final day of classes prior to schools being closed due to the pandemic. The mark will be communicated to students by April the 22nd. However, as stated, and this is very important, learning is continuing and students are encouraged to engage with their teachers to ensure they maximize their opportunities with respect to achieving curriculum outcomes. For graduating students in particular, Level 3 students on track to graduate will be eligible to graduate. Options have been developed for students who may be at risk of failing a course and for students who may have already failed a course. And the district is in the process of determining the need for computer hardware and connectivity for students without access. The school districts will be providing further detailed information on these plans this afternoon. If at some point school resumes, the time remaining will be used for instruction rather than writing exams. I also want students to know that guidance services will be available to all students, and they will be available to schedule individual service or to join group sessions based on areas of interest. Professional learning opportunities will be available for teachers to support them in operating in a virtual learning environment. And I'd like to take this opportunity to thank Dean Ingram and others at the NLTA for their input and for working with us during this time. It's very much appreciated. We have had productive discussions to ensure the needs of students are being met and that learning will continue. Discussions have also been held with our public post-secondary institutions regarding entrance requirements for the September 2020 term, as well as the process for determining scholarship requirements. Both Memorial University of Newfoundland and Labrador and the College of North Atlantic recognize the need for flexibility so that students are not disadvantaged when applying for post-secondary studies. As mentioned, the school districts will be communicating directly with their school communities this afternoon with further information and details. Thank you.
Thank you, Minister Warr, for the information and the update on our K-12 system. It is really another example of how we're addressing both student and staff safety during this time. But we will, and we've made a commitment that we'll keep learning opportunities ongoing through the COVID-19 pandemic. And results made possible with the support from community organizations and industry, all critically important during this time. So I too want to thank the Minister, his department, our school districts, both English and Francophone, and as the Minister mentioned, the NLTA, and also these educators who have kept in constant contact with our students. So there's been a number of people involved in making this happen for our student population, all of us committed to the well-being and their education. So it is by working together in all areas that we will get through this together. I will now pass it over to Minister Haggie for a few comments.
Thank you very much, Premier. Well, we've seen again another increase on today's figures compared with previous days. We are, from experience of our other jurisdictions, not yet into our likely surge period. This is likely to come over coming weeks, and we are working hard to see if we can understand when that might be. But as has been referenced, this is a long haul, this is a marathon, not a sprint. And I think families now need to look to plans for Easter to have a more virtual gathering, and maybe even well into May and the usual traditional start of Newfoundland and Labrador's camping season. We have seen from other jurisdictions, however, the benefits in the way they have been able to reduce the demand on their healthcare system by physical distancing. And you've heard us mention this, and you've heard us emphasize it. But there is data now out there from places like BC that show very clearly that physical distancing and spending time apart is the key in our battle to reduce the effects of this pandemic. We have seen, and again, this is the time of the month, if not the year, when those of us who have smaller incomes and are more reliant on help see the checks arrive, be they GST or the seniors benefit from the province and these kind of things. And so it's natural that at this occasion people would want to go out and do their weekly grocery shop and stock up. We have seen examples of how it can be done well, and my attention was drawn today to Costco, for example, where they have good social distancing, orderly lineups, and limits of people in the store. But I've also seen pictures from Lewisport, from Corner Brook, of large groups of individuals hanging around outside the stores waiting for them to open, not practicing physical distancing. This is not acceptable. It is dangerous. Physical distancing saves lives. It is important as well that employers and store operators realize they have a responsibility too to adhere to Dr. Fitzgerald's orders. If there are instances that people are concerned about, then there are ways to report that. We have a public reporting form online, and I would encourage people to use it. We have seen a growth in the response to this form, and indeed it's a sad commentary that at least a third of those that have submitted forms are actually from outside Canada. It is a testament to what our department and what this country has done to try and support Canadians, that people are looking to us to help them in Nevada and Florida with their issues. It is sad, however, that we cannot assist them in this. We have only 4 outstanding issues under investigation by our RNC or RCMP. I have also been asked by those bodies to emphasize to the public that 911 should not be used for reporting issues around COVID-19 compliance. That is there for a different purpose. The form is there. There is an active response team from both RNC and RCMP to deal with these issues, and there is minimal delay in getting them addressed. Physical distancing is really important. I can't overemphasize its relevance. I've had reports again of teens in cars in groups of 4 and 5, and there is an onus on both the teenagers and their parents to be responsible in this matter, because at the end of the day, their actions will affect all of us. We are a social being. Human beings want to get together, and I understand this. And whilst we have stressed technology for keeping socially connected, again, there are challenges with the use of that. And I've been told and I've been asked to bring up the issue of dating apps. They are very common and have been seeing an increased uptake over this challenging time around COVID-19. But let me warn you, if you use Tinder or Grindr and you swipe right, you might get more than you bargained for. So please be careful when you use these applications. One of our challenges locally and nationally has been around personal protective equipment, PPE, and I've referenced this before. We are engaging provincially, nationally, and at the federal and international level to try and source these materials and these pieces of equipment which are consumable and in demand. This is not a situation that is unique to us. We continue to meet regularly with our healthcare workers to discuss how best to use PPE and how to use it on the basis of evidence. Our problem is what's called burn rate. It is being used at a rate that is up to 6 times greater than we would normally experience, even with our flu season here. We have had some deliveries, we have orders placed, but it is a challenge, and I urge all of you at home or on the front line to be conscious of the need to be careful with its appropriate use. We want a safe environment, but we need to be responsible about how to use this equipment. A final note is under other circumstances. Today, I would probably be on my feet in the House of Assembly to mark World Autism Awareness Day. People on the spectrum have challenges with things that you and I might take for granted. And for them, for a lot of them, routine has been really a key part of their lives. We have disrupted that routine to keep them safe, but it has produced challenges for their families, for these individuals, and for their caregivers. And I would urge our population to spare them a thought on a day that is supposed to mark awareness of autism. And in that vein, I would just like to close by reminding people that for non-COVID related stresses related to self-isolation, there is support through the provincial and national Red Cross. That number is 1-800-863-6582. And once again, make a bubble to protect yourself and your family. Stay in that bubble and don't burst anybody else's. Physical distancing will make a difference. It's all our responsibility, and the time to get it right and make a difference is now. Thank you, Premier.
Thank you, Minister. We will now open it up to the media for questions.
For the benefit of our speakers, we have 8 reporters registered for today's call. In the essence of time, each reporter will have the opportunity to ask 2 questions only. We suggest that you not ask rumor-based questions. We will run through the telephone queue so each reporter has an opportunity. Following this, should time permit, reporters can ask single questions only. This call will end at 2:59 p.m. and further questions can be emailed. Operator, please proceed.
Thank you. Please press star 1 at this time if you have a question. Our first question is from Peter Cowan from CBC News. Please go ahead.
Minister Haggie, you've mentioned there are some examples of orders that go missing, goods that are being snapped up even as they're destined for this province. Can you give us some more specifics in terms of the challenges and some of the issues you're facing when you're trying to get more of that PPE that we're burning through?
Certainly. Under normal circumstances, we would have our regular supply orders in. Those have been placed on time. And then over the course of the winter, particularly with flu season, we would place supplemental orders. Some of these are predicted, and we do know from previous experience what our typical flu season would bring. What happened is that the principal location in a global economy for the manufacturer of PPE has been Hubei province and Wuhan in China. When that happened, it became very difficult to fill orders. Since then, we have seen, unfortunately, a trend for opportunism to creep in, and you see fake inventory, you see orders where you can only secure them by putting a deposit, and then the order never materializes. And Minister Haggie and the federal government have been very frustrated by this. They would have more details of some of these, but certainly our challenge has been we're getting parts of our orders and we're getting the rest delivered in an unpredictable fashion, which is producing the challenges on the front line because of the increased demand for PPE.
In some places in the U.S., the orders are more strict than here, requiring people to stay inside their homes except for a very specific list of things. Our guidelines generally say that, but that's not enforceable. Why not bring in more specific enforceable rules around it?
We have seen from other jurisdictions, and in actual fact, we've led a lot of jurisdictions because we have in place in Newfoundland and Labrador those restrictions that you've seen across the rest of Canada. We put those in actual fact, Dr. Fitzgerald puts those in on the basis of best evidence and public health advice. We will be as restrictive as we have to be to secure the health of the population here. The challenge is we've got to live with these potentially well into the summer. So what is manageable for 2 or 3 days will not be practicable for 4 or 5 months.
Thank you. The next question is from Kellyanne Roberts from NTV News. Please go ahead.
Thank you. Are any cases of COVID-19 in any of the nursing homes or long-term care homes in the province?
No.
Thank you. And Minister Warr, I'm getting a picture now regarding this announcement today. How can you issue a grade to a student who is doing semesterized courses and has only one unit completed out of 6 with little to no assessment completed?
I didn't get the first part of your question, Kellyanne, but I think you're talking about semesterized schools, and if that's the case, semesterized schools, absolutely, you're right in the fact that, they have just finished their first part of their semesterized year, and I guess wrote exams in January, and they're only 25% in the second part of their semesterized program. And certainly we will continue to work with those students as well. I think there may be 6 or 7 semesterized schools in the province, 5 of which are in Metro, 1 out in Lethbridge, I think, and 1 maybe in Corner Brook. But we'll continue to work with those, with the instructors, teachers, and the students to make sure that we get that program in place as well. We will provide all resources that we need to ensure that these students are given fair opportunity.
Thank you. The next question is from Ben Murphy from VOCM News. Please go ahead.
Yeah, and Minister Warr, just a bit further to that, a lot of what you mentioned was online tools, online resources for students. But what about those students who don't have access to internet or Wi-Fi, as public libraries and such are closed? They might be in rural areas.
Thank you, Ben. And I mentioned earlier on that we are actually assessing the assets that are presently in our schools, and as the Premier had mentioned, no student will be disadvantaged here because of connectivity. We're working with internet providers as well, and we will make sure that we get the proper resources in place. We will do whatever it takes to make sure that each child is given the opportunity to learn.
And Dr. Fitzgerald, previously you've said that there was no evidence that pregnant women were at any more of a risk with COVID-19 as the general public. The Canadian government website says the same thing, yet, for example, BC's Nurses Union is telling pregnant healthcare workers to work from home, and if that's not possible, to apply for the federal paid leave of absence. That's concerning some pregnant healthcare workers here, saying that maybe they should do the same. What do you say to those workers?
So what we've said to everybody is that anyone who can work from home should work from home. So pregnant women would be part of that, everybody. So the evidence that we have right now says that this doesn't appear to affect pregnant women more significantly than other respiratory illnesses. Obviously, we don't want pregnant women to get sick while they're pregnant. That's a given. So if there is concern with regard to exposure, I think that's a conversation that women need to have with their employers, and it has to be on a case-by-case basis.
Thank you. The next question is from Patrick Butler from Radio Canada. Please go ahead.
Hi there. I'm just looking to follow up on your discussions with the Francophone School Board. They issued a communique on Tuesday that said, for example, that all students in high school would be guaranteed a mark of 50% for this year. It's a little different than what you're announcing today. I'm just wondering why things would have changed over the past few days, and whether there were other things that were modified since you met with the school board last Friday.
With regards to, we've had ongoing conversations with certainly the Francophone School Board and NLTA, and the plan is to provide a mark for the student up to March 13th, and we will be sending home that report as of April 22nd, and again we will ensure that there are resources put in place for students to raise their marks. We've talked about the opportunities for credit rescue and credit recovery. These are 2 avenues that certainly teachers would be well aware of. They have the opportunity to engage with students to make sure that they give them every opportunity to make sure that they either up their mark or pass their grade.
And I've been seeing the questions from people regarding to, what should they do if their employer still asking them to go to work, but they're having second thoughts. They don't feel comfortable doing so. What's recommended for people in that situation?
Well, anybody that has, if they would have legitimate concerns about not going to work as related to physical distancing or access to proper hygiene and washing facilities and so on, we do have in place through our occupational health and safety inspectors that could actually visit those sites as an example. But, it's incumbent on the employer to make sure that they are abiding by, following the recommendations and the guidelines that have been put in place by the Chief Medical Officer. So if there's a concern, first and foremost, I'd ask and suggest that the employee should go to the employer. And if so, we will certainly put inspectors in place to make sure that that workplace is safe. We know that the best ammunition, the best tool that we have is to practice physical distancing to stop the spread of COVID-19. And we expect that in the workplace, just like we expect people to have to do that in their own homes and in our communities as well.
Thank you. The next question is from Marika Wash from the Globe and Mail. Please go ahead.
Hi, Premier. I'm wondering if you can explain to me why Newfoundland hasn't released its scenario modeling that shows sort of the range of fatalities and severe cases that the province could see with this pandemic.
Well, first of all, we're tonight, I will say, with a meeting with the Prime Minister, that we will be discussing models, on a national model. And of course, early days in Newfoundland and Labrador when it comes to modeling and putting what would be a modeling in place. I know this morning we had some meetings already with the Minister, and I know Mr. Haggie has some more information. He could expand on this question. I'll give him the opportunity to do so. But it's important that all of us must remember that regardless of what the model is, the best tool that we have simply is to practice physical distancing. We have that option available to us. We can wait and get the modeling, and that will be critically important as we anticipate and plan for the surge. As the Minister said, when it hits Newfoundland and Labrador, we're not quite there yet. But in terms of putting the modeling in place, the responsibility is on every single Newfoundlander and Labradorian. And I would suggest to every Canadian to make sure that they practice physical distancing. That is the best tool, the best ammunition that we have.
The issue of modelling is an interesting one. It's an important one. Basically, what a good model will do is give you a fuzzy guess into the future, maybe 7 or 8 days down the line. If you look, BC, which did release its models recently, is significantly further ahead of us in the evolution of their COVID pandemic. We are anywhere from 2 to 4 weeks behind. Our challenge really is around data and the magnitude of the data, the numbers that we have. We've had one, as it were, outbreak, one cluster, and that very much skews data, and we've seen that elsewhere. If you take that data out, then our numbers at the moment do not lend themselves to modelling. So we've laid the groundwork for when that changes. So when the opportunity presents and the data is available, we will be in a position to produce models and scenarios. But again, I would reiterate what the Premier has said. We can change those models and we can change the validity of those models for the better by the things we put in place already. And I would urge people to take those orders very seriously, to concentrate on physical distancing and stop looking for loopholes that can make you return to normal quicker. Doing that now will delay the return to normal for everybody else.
Thank you. The next question is from Peter Jackson from The Telegram. Please go ahead.
Hi. Premier, the United Steelworkers have asked you for a number of restrictions in Labrador, wanting all visitors to self-isolate, using a permit system at the border, closing down Wabush Airport to non-essential travel. Are any of those measures being considered?
So I did speak with the president of the United Steelworkers yesterday, and we really appreciate the engagement that we've seen out of Labrador West. I've also spoken with the MHA on a couple of occasions, also speaking with the mayor. As a matter of fact, I was on the phone with the mayor of Labrador City just prior coming down to this media availability. So what's happening in Labrador West right now, we've been looking for, the issue here is around non-essential travel going into Labrador West. As you know, we've taken those charters that they're not going through the airport anymore. What they do is you're picked up on the tarmac with chartered buses, so then they go directly to the mining sites, and likewise when they leave. So this is not what, so the idea here is create that physical distancing that we talk so much about. So that's happening there. So we're also monitoring the number of people that are actually traveling into Walbush. And matter of fact, I gave examples, and the numbers are quite low of travelers that are coming in through PAL and Air Canada and so on. As a matter of fact, Air Canada will not be going into Walbush effective March the 31st. So the whole idea here is not to restrict essential travel, but make sure that we keep essential, non-essential travel. There'd be no non-essential travel. Also of interesting to note, and I really want to congratulate the communities in Labrador West for the proactive work that they are doing. They are setting up their own checkpoints. So we gather the information inside the airport, but the community itself has taken on the initiative to support the guidelines that the Chief Medical Officer has put in place, and they're setting up their own checkpoints, handing out this information as you enter Lab West. The whole idea here is, as the Minister says, to put a bubble not only around the individuals themselves, but put a bubble around that community to keep COVID-19 out of Labrador West, and we can do that in other communities as well.
Thank you. As well, Premier, I'm wondering, the Moody's grade has remains at A1, but it's now gone from stable to negative. Will that impact your borrowing efforts as they continue?
Yeah, good question, and we really want to settle some of the questions that are on the minds of our public sector workers, contracts that we have in place, making sure that our pensioners, the pension is intact, I will say. So we've been now have the borrowing capacity. We have $2 billion that went through the House of Assembly that we can now go to markets. We've had some success in the markets this week, which has been supported, by the way, of the Bank of Canada, which was important for us and will be important, I will say, to other provinces as well. So we're now in a position that we can borrow. Some of the comments that I've made in recent days was really, as we come out of COVID-19, what our economy looks like. And so the stronger we can actually position our businesses going through COVID-19 and this pandemic means that we are in a better position coming out of this pandemic. And so, but right now, let's be very clear, our priority is on healthcare with Newfoundlanders and Labradorians, and keeping in the back of our mind as we work with our business leaders within our community to come out of this, and our businesses are ready to respond. But indeed, people will be paid, contracts will be met. We're in a position to borrow to keep our economy going.
Thank you. The next question is from Elizabeth Whitten from All News Labrador. Please go ahead.
Hi, I'd also like to ask more about the disappearance of the PPEs mentioned yesterday. Is it possible they could be recovered, or is it just accepted that they're gone and we won't see them again?
I suspect some of them never existed in the first place, and that's another issue that the federal government are having to deal with. Our thrust is to go through and continue with our normal and national procurement routes, as well as the emergency stockpile. In addition to this, we have a very active group of local entrepreneurs who have produced prototypes of gowns and face shields and gloves, for example, and those are currently being assessed locally to see if they come up to the specification of the materials we would normally buy. Because if they do, then we actually have a chance to manufacture our own PPE locally, and that will reduce our reliance on outside circumstances that we can't control, and reduce the risk of Newfoundlanders and Labradorians being taken advantage of by unscrupulous parties outside the country. It will also help our neighbours as well by enabling more stock to be available nationally.
So if I could add to that just for a second or so, what we're seeing right now is, as we work with our local our local group of people, as the Minister just said, that is really complementing some of the great work that's being done at the federal level, but also we're looking at within our Atlantic provinces, within our colleagues in other provinces, and they too have opportunities. So it's a shining example of where we're seeing our provinces work together, our businesses working together, our volunteers in our community working together to complement the work that's being done at the federal government. So the opportunities and the examples that the minister has said of PPE missing at airports or fake orders and so on, that we will not have to worry about that. And so indeed we are prepared to meet the surge of COVID-19 throughout not just Newfoundland and Labrador, but across this country.
Right, and could there be any investigations or legal repercussions to some of these, disappearing orders or fake orders?
I mean, certainly that would be a discussion that the federal government would have to have. But I think some of the challenge is that these orders and these manufacturing contracts or agreements have been placed in countries outside of Canada. So the investigation of those would lie outside of Canadian authority. I would certainly take a very dim view of any local or national Canadian company who tried to treat us like that. And really, we've had no evidence of that, quite frankly. The uncertainty of our wholesalers and the Canadian market is, in actual fact, either getting raw material reliably or indeed just being able to give certain delivery dates because of demand.
Thank you. The next question is from Holly Mackenzie-Suter from Canadian Press. Please go ahead.
Hi. So nurses across Canada and in this province are asking now for the ability to decide what mask they can wear when treating COVID-19. So is the province going to give them the authority to make that decision, and if not, why?
There has been a very collaborative discussion between not only the nurses, for example, but the groups representing licensed practical nurses, respiratory therapists, and other workers in healthcare who would be at elevated risk. There are very clear guidelines from infection and control. There are very clear guidelines from infectious diseases. And we're working to make sure everybody's on the same page. From the point of view of given clinical scenarios, there are always options there, and we are encouraging people to take those choices, but to do so conscious of the fact that their use of PPE is done in the context of limited supply and constraints. And until we can guarantee unlimited supplies, we have to make sure that we are really rigid about the appropriateness of the particular mask or the particular gown or particular set of gloves that is used. And we've not had any evidence of any issue with that concept from either nurses' unions or NAPE or any of those other bodies.
Thanks. And just to follow up to that, what is the shortfall of masks right now, and how many more are needed?
At the moment, we are relatively well off for masks. Our challenge lies around gowns. The previous week, it was around gloves. And on any given day, the stocks of each of those may fluctuate. We have 9 items that we regard as crucial, important PPE. Some of them are just different sizes, common sizes of the same mask, as it were. So on any given day, it's very difficult to be terribly specific. Normally, our system would have around 60 days of burn rate with the inventory we carry. There have been occasions when that's been down to 10 days.
Thank you.
We will now open the lines to single questions from reporters, and you are reminded that this call will end at 2:59 p.m.
Thank you. Once again, please press star 1 on your telephone keypad if you have a question. Our next question is from Peter Cowan from CBC News. Please go ahead.
The Calls Funeral Home event was more than 2.5 weeks ago, but we're still seeing more cases related to that cluster. How concerned should we be that there continues to see spread from an event that happened 2.5 weeks ago?
Sorry, Dr. Fitzgerald, carry on.
Yes, so certainly as those people may have gotten exposed at calls, they may not have become symptomatic or were able to spread that virus right away, hence the incubation period. And so it could have been several days before that was able to be passed on to somebody else. And if they brought it to a close contact and passed it on to a close contact, it would be unexpected that we would see them out beyond the 2 weeks from the initial exposure.
Thank you. The next question is from Kellyanne Roberts from NTV News. Please go ahead.
Minister Warr, you noted that if schools were to resume this year, it would be to focus on learning, not exams, a big if. But are we expecting that there could be no return to classes in the fall as well? Have we started planning that far ahead in terms of contingency?
Certainly, Kellyanne, yes. I mean, we're looking at all opportunities here. I mean, our hope is that we're able to get back into the classrooms this year, and we stick to that hope. I've mentioned earlier on in my remarks that exams are going to be canceled for this year. Instructional time right now we feel is a priority with both the district, the department, and NLTA, and we want to ensure that we give every opportunity to students, to make sure that they have all the resources available to them. But if we go beyond that, I mean, we are looking at September, and our focus will be on making sure that we're all prepared at that particular point in time.
Thank you. The next question is from Ben Murphy from VOCM News. Please go ahead.
Many students are concerned to rely on summer employment to get by for the year, including paying tuition, and a lot of them don't qualify for the federal assistance. What's going to be done for these people?
Well, I think there are a number of people right now that we need more answers on that would qualify. Students being one of those. Of course, our tech sector is another group. We have many startups within our community right now that are not in a position because simply there's not really a program that clearly defines where they would fit into some of the federal programs. But I know part of the discussion that we will have tonight will be about students, because some of them really did not make enough money in the previous months and over the year to qualify for some of the emergency funding. So students, number one right now is an area that we need more clarification on. And number two would be around the startup community within Newfoundland and Labrador, but indeed this is true for all across the country. And I will say too that I've already spoken to the new president of Memorial University, and I'd like to welcome Dr. Vianne Timmons to Newfoundland and Labrador. First day of work was April the 1st, and we've already had a discussion about how Memorial could use more students during this summer as well.
Thank you. The next question is from Marika Wash from the Globe and Mail. Please go ahead.
Thank you. I just wanted to follow up my question because I didn't get a second one in the first round of questions. Premier, will you call or are you supportive of Ottawa releasing the modeling so the Canadian public has a better sense of where we're heading and just how we compare to other countries?
Well, what we know when we go through situations like this here is through this pandemic, lessons that we learn from jurisdictions can be important as we make decisions. But right now, we're very comfortable with the positions and decisions that's been made by our public health officers, in particular led by Dr. Fitzgerald. But indeed, information from modeling on a national perspective, can be helpful. It's good information. But more importantly is follow the rules, follow the guidelines that we put in place. Regardless of the model, what we know that works best, the best tool that we have available to us is to practice physical distancing. That will help guide us through this and will, as the minister said so many times, it will flatten the curve so that we can actually respond to those that when indeed they need the available health care services for us. So, would I be supportive? Yes, I would be. Information is an important piece of this, but most important is to abide by the rules and the guidelines that we put in place here in our province.
Thank you. The next question is from Patrick Butler from Radio Canada. Please go ahead.
I just want a little bit more clarification on the calls cluster. Have there been any more cases linked to that? And are you still encountering any challenges related to that? I guess that situation that originated at the funeral home.
There are cases in the last couple of days that have been related to calls. With regard to challenges, no, I think the process is the same regardless. If we have contact tracing and if those reveal close contacts who may have been exposed, we will continue to recommend or advise isolation and quarantine of cases and contacts. So the process is the same regardless of when we find cases.
Thank you. Once again, please press star 1 on your telephone keypad if you have a question. We have a question from Peter Cowan from CBC News. Please go ahead.
We haven't heard about community transmission in a few days. I'm wondering if you could give me the latest numbers in terms of how many cases we have that can't be traced back to travel or the cluster.
Much of the investigations in the last couple of days are still ongoing, so I don't have that information specifically today, but certainly when we have information like that, we will certainly pass it on.
Thank you. The next question is from Peter Jackson from The Telegram. Please go ahead.
Premier, I may have misheard earlier. You said 65 daycare workers, or I thought you said operators, but it might have been workers. Have any daycare operators facilities actually reopened?
So what we have right now, we're working through with our daycare operators, with our childcare operators, and so first of all was to identify the work that we did over the weekend was to identify how many people, how many essential workers out there would require daycare or childcare services. So we did that over the weekend. These would be verification, confirmation would have to be given by the employer of those essential workers. So we've been working our way through that. So we have now some 65 childcare operators that have stepped up. There's considerably more than that within the province. But what we're trying to do is fit, the operator to the child and the parent that would be requiring that service. So right now, if you were an operator that had the child of essential worker in our province, well then what we're asking is to take that child back into the operation, keeping in mind that the guidelines are very different. Physical distancing, the numbers within those operators, the number of students going through those operators would be much, much smaller. So there's not a lot that require the services of early childhood educators, but there will be some, and they're stepping up now. There's some 65 of them involved.
Thank you. The next question is from Kellyanne Roberts from NTV News. Please go ahead.
Thank you. Minister Haggie, yesterday you said 379 healthcare workers were in self-isolation. Some of those have used up their sick leave. Are they forced to take that time without pay or use up vacation?
My understanding from the federal government is that there is an arrangement whereby there will be recognition of COVID-related sick time, isolation time. From our point of view, we have not discussed in detail whether that would be a federal bill or a provincial bill, but it is not our intention to penalise anybody who has had to use time off work for COVID isolation, particularly if it's been connected with work. So we'll work with those individuals to make sure that their leave entitlements are managed appropriately to their satisfaction.
Thank you. The next question is from Ben Murphy from VOCM News. Please go ahead.
Premier Ball, if a child care center is asked to open but they refuse, will they lose funds from that original compensation agreement?
Well, keep in mind right now with our childhood operators, we're paying them as if they're at full capacity. So they receive their operating grants, they receive money for the spaces. There's some 8,000 spaces within our province, and there's going to be not a lot of people that will going to be require access to our regulated child care operators. So I think there's an expectation by people in Newfoundland and Labrador that if we're willing to pay for 100% of your capacity, keep your operating grant in mind. I cannot think of why an operator would not want to step up and support the essential workers. And keep in mind, these are people that are going through the door in the mornings and the evenings, and they go into some very difficult situations. So I think it's incumbent on every single one of us to step up and support our essential workers. And we're really not at the stage where operators or child care operators are declining to do so. What we're doing is offering to work together with them. So realize, that it's not penalties that we want to impose. All we're asking for, let's support our essential workers.
Thank you. The next question is from Peter Cowan from CBC News. Please go ahead.
We've heard conflicting information about whether or not it's okay if you're not in isolation to go out for a drive to have a little bit of a change of scenery. I'm wondering if we could get more clarity on that.
So if you're not isolating or on quarantine and you're not symptomatic, then it is okay to go out by yourself for a drive. What we're discouraging are groups of people going out for a drive together in a car, which is an enclosed space. People outside of your bubble joining in the car ride. That would not be recommended.
Thank you. The next question is from Peter Jackson from the Telegram. Please go ahead.
Mr. Haggie, you mentioned before that you're looking at trying to repurpose manufacturers. Are there any manufacturers in this province who that you've had talks with who can retool what they do to provide PPE?
Through the group of entrepreneurs, they have identified people who can do that within the province. We've certainly had offers in the department directly for 3D printing, for example, both from groups in Memorial and in St. John's, and also a group on the west coast of the island. I've even had drill bit manufacturers from Minister Warr's district offering their services free, and woodworking facilities. So people are stepping up. The challenge is around what is necessary at the moment and what might become necessary over time. Our main challenge at the moment is around PPE and reagents for the laboratory.
We have time for 2 more questions.
Thank you. The next question is from Patrick Butler from Radio Canada. Please go ahead. Make sure your line is unmuted.
Hello, sorry, it was. Wondering if you could talk about supports for children with disabilities or learning impediments, and how the new measures announced today are going to affect them.
Well, certainly we recognize that there are students with exceptionalities, and we'll make sure that instructional resource teachers connect with families and students, certainly to offer support for ongoing learning and individualized programming. I mean, we encourage parents of those students certainly to contact their teachers, and we'll make sure that teachers are available to support these students who have exceptionalities.
Thank you. And the last question is from Kellyanne Roberts from NTV News. Please go ahead.
Thank you. Minister Warr, has there been any time outlined for when students can get their belongings from the schools?
We are continuing to work with the district with regards to that, while certainly adhering to the ongoing news and information that we're receiving from the Chief Medical Officer for Health. So until those opportunities are there, certainly we won't be availing of those student. We realize that there are items that people want to be able to pick up, but as soon as that's made available, we'll certainly make sure that we get back to the parents.
Thank you very much for attending. The time for questions has ended. Please tune in tomorrow at 2 p.m. Newfoundland time, 1:30 Labrador time for our next media availability. Thank you.
Thank you. The conference has...